Hi, my name is Katie Blackman, and today I'm here to talk to you about moral relativism. Moral relativism is a view that nothing is absolutely right or absolutely wrong. Many people can have different opinions on something based upon their culture or their values set in stone. So, as an example of moral relativism, today I'm going to talk to you in the subject of medical law and ethics, and to fine-tune that subject, I'm going to talk about medical euthanasia. Now, medical euthanasia is a very taboo subject. Not a lot of people talk about it, and that's due to the fact that many people view it essentially as murder. But in my opinion, working in a medical field, you're going to see things that you don't agree with or decisions that you don't agree with, and euthanasia is kind of one of those things, or medically assisted suicide. Medically assisted suicide is legal in the state of North Carolina. It's known as mercy killing or medically assisted suicide, and it's a very controversial subject. One person could view medically assisted suicide as very wrong. It's basically killing someone, it's murder. And then on the other hand, for people who are dealing with a very terminal illness or a lot of pain, they may look at it as an sort of out, or a way to pass away peacefully and be able to be in control of something that's going on within their illness. So I'm going to talk about different types of euthanasia, and then I will go into more details. Active euthanasia is a euthanasia by which causes the immediate death of the patient. It's a deliberate action of the physician. So, for example, when a lethal injection is given, or an overdose of a painkiller, and the physician knows what they're doing. They don't do it, on accident. It's done on purpose. Passive euthanasia here involves an incident or an indirect action that causes the death of the patient. So this could be dealing with the patient's treatment, and the physician chooses whether or not to give that treatment, and because of their decision, the patient ultimately passes away. Another type of euthanasia is involuntary euthanasia, and that is often equated to a murder. Like, most people on one side would view it as a murder. The patient doesn't opt for this thing to happen to them, and they don't get to pick. Basically, for an example, could be someone who is in a coma and they can't make their own medical decision. Someone has to make that medical decision for them. And ultimately, there are things that are either right or wrong within the medical euthanasia thing. But my biggest view on it is that if a person is indeed in a lot of pain and they can't get through that pain, if they have no other options for pain medication or, treatment plans that could help them, then yes, I believe that that person has the right reserved that they could commit suicide with the help of a physician. And it kind of gets blurred lines whenever you get to talk about moral relativism, and you're viewing someone who's in a coma or, hooked up to a ventilator. They don't have that right anymore to choose, and someone's having to make that decision. Well, are they going to make it? Are they not going to make it? And it's basically someone, making that decision for them. And I don't agree with that part of it. I believe that it's kind of a gray area. It's moral relativism. One person may view something within the subject right, another wrong, and that's basically what part of the first thing that I learned in ethics is that not everyone is going to have the same morals. Um, Not everybody's going to see eye to eye, and that's part of the moral relativism. Thank you for your time.